An example of a patient who worked with me and had a specific health goal was a woman who was diagnosed with prediabetes, and she was kind of just looking around wondering where to start, and her doctor advised her, losing weight would be an excellent way to lower your risk of later getting diabetes.
I've had pretty wonderful doctors who were supportive, but the time was only limited. So having the extra support from a community resource specialist, it's kept me motivated, it's kept me encouraged.
I answer questions that patients may have thought about that the doctor possibly couldn't get to, and I can also, be that person who says, I'm gonna call you and we're gonna talk about this next week. I go out to local community organizations and I learn about events going on, and then so I can bring them back to the clinic, so I can tell patients about them so that I can advertise them. This is a community resource board. We have a few of these throughout the clinic.
It's really empowering for people to be able to work with community resource specialists because they're not fixing something for someone, they're connecting them with things that will empower them to be more active, to connect with other people.
Sometimes you don't connect with the right person, and sometimes you don't know where to go for extra support with working out in the local community. And it was nice to go to the community center to see people like me working out and exercising.
Having the community resource specialist there allows us to actually bring the village into the clinic and leverage that village to make this patient much more likely to succeed in their own treatment plan.
Our clinic has really embraced the idea of having a community resource specialist that can meet with the patients and help them find those resources, as well as working with the team.
I'm of an age where my memory slips and you're supposed to start doing new things, and I want to learn to play bridge again. Ask her if she knew if the senior center had them, and she said she wasn't sure, but she would call. And she did, and she not only called, but she had them send her some literature, and she went through it and marked all the places.
It really is a different level of, when we talk about care for our patients, and that's the caring piece. And our community resource specialist is the face of our clinic out in the community. It shows that we as a clinic care about our community.
My wanting to play bridge. I need it, number one, for my memory, because you need to learn to do something, and so I've got to learn to do it again. And then the other thing is that she cares,
Those kinds of things really empower people to live better lives and to be healthier, and then everyone benefits.
Started to try different outdoor activities that I've always wanted to try. I learned stand-up paddleboarding for the first time this summer.
The community benefits when the people living here are more engaged.
I just hope it continues. There are so many people like me who need the support.
Everyone benefits, both the individual, the health program, because they're seeing less illness. It's really got a preventive aspect in that regard.
So I think the findings are positive enough, the experience was positive enough, the satisfaction from our patients was good enough that it's pushing us to really think about how we might integrate this into the current primary care model.
And I think it's a great idea, and I would love to see it expanded, because the only thing that keeps me on the coast is group health.